Hello, my name is Ilkka Helenius. I'm the professor of orthopedic surgery at the University of Helsinki and Helsinki University Hospital. Pediatric bone lesions are rare conditions but quite problematic to treat. Many of them present with a pathological fracture, and in the classic treatment after intralesional surgery, they are very prone to recur. For this multicenter randomized clinical study, we compared the golden standard treatment, intralesional curettage and allograft bone grafting, to similar surgical management but filling of the defect using bioactive glass. We recruited 51 children which were equally randomized to be treated with allograft versus bioactive glass. In this study, we observed that the risk of pathological fracture as a presenting sign is very common, as up to 50% of our patients presented with a pathological fracture. The filling material was not statistically significantly associated with risk of recurrence. However, in a multivariable analysis, the risk of larger recurrences tended to be more common in the allograft group. One downside of using bioactive glass was the relatively difficult revision surgery if needed. The mixture of newly formed bone and bioactive glass is very hard, and therefore high-speed burr was needed to go through for the revision surgery. We conclude that allograft and bioactive glass produce similar outcomes in terms of the recurrence of the pediatric bone lesions in a randomized clinical trial. Thank you very much for your attention.